Bienvenidos a el webcast de Abriendo Caminos en tu vida, guía de preparación para la rehabilitación psiquiátrica. Abriendo Caminos en tu vida means opening doors in your life, and this is a guide to help people prepare to think about engaging in psychiatric rehabilitation. This guide was developed by myself and Marianne Farkas and Laura Diaz, my colleagues at Boston University Center for Psychiatric Rehabilitation. We are a research and training center in psych rehab, and we've been working with Latino initiatives for the last 8 years, really trying to develop tools and train bilingual communities in the best ways to engage Latino consumers and their families in the process of psychiatric rehabilitation. This project was funded for NIDR, the National Institute of Rehabilitation Research, and we're very grateful that we had the opportunity to develop this fantastic tool to help Latinos think about their rehabilitation process, to think about rehabilitation. Like all of our projects, we do this in collaboration with first collaborators from the beginning, Community Research Foundation in San Diego, California, Baco Human Services in Boston, Massachusetts, Center Club, and Casa Primavera. And for Community Research Foundation, I forgot to mention there were two clinics that we work with. That was Maria Sardinas and South Bay Guidance Center. The reason we wanted to have collaborators both in the East and West Coast was that we wanted to be representative of the largest number of Latinos within the U.S., which is Mexican-American descent. We know, and we wanted to ensure that we will include in this guide the difference. We recognize that Latino is a very huge word, and we are a very heterogeneous group. Therefore, country of origin, whether people are born in the U.S. first, second, third generation, we're taking into account, and all the people that we work with really help us with this. So we're definitely conscious, very conscious that what happened. We also collaborated the Northeast Independent Living Center here in Lawrence, Massachusetts, Henry Acosta, the New Jersey Mental Health Institute, the Puerto Rican Family Institute in New York, Manhattan, the Jersey City Mental Health Clinic, also a program of the Puerto Rican Family Institute, and in Massachusetts, also the Holyoke Health Center. And if we were not for this collaborator, we were unable to really complete this project that has been going on for the last 4 years. So what is the Abriendo Caminos guide? The Abriendo Caminos, where is it coming from? What is the underlying mission of this? Is really based in Visión de Recuperación, which is a vision of recovery. The director of our center, Dr. Bill Anthony, and other colleagues at the center have been talking about the vision of recovery for many years now, and we know that when we talk about recovery from mental illness, it's really being able to overcome the catastrophe of a mental illness and really getting ready to revisit new roles and join a life that people really were missing and want to lead to successful lives. So this guide, Abriendo Caminos, is a tool that really is based on the values of recovery. It's really designed to really help the process of recovery and embrace the values of it. It really promotes hope. It is a very positive and inspiring tool that will allow Latino, Spanish-speaking consumers and their families, if they want, to really take a look at what is it that I want to do with my life, and am I ready to think about a change? It is very respectful and really promotes dignity, and the language that has been used, the colors and everything has been really taken from their consumer's point of view. We took into account, and we interviewed lots of focus groups where we did really a lot of interviews with people, and we really were able to respect not only cultural values but also respect the dignity of the individual that we're going to be doing this guide with. It really kind of is going to lead into the whole goal of rehabilitation, which is to develop supports and skills and supports in order to achieve preferred goals. But this is the the phase before all that happens. So it really helps the person take a look of whether or not they are ready to think about making a change in their lives. One of the things that is very essential is in this guide is that it's designed to really do individual participation, actively involve the person in the processes. It's the person that is the one really, the guide is intended for the person to complete it themselves. And if by any reason they cannot read, they choose not to read, don't want to write or read, there's a guide is done with a facilitator that can facilitate, but at all moments, really individuals really want to be able to make choices about their own life. For the last few years, our center really has been looking at doing several research projects on research and on recovery, and we really know there are some phases that people go through in recovery that are very important to consider, and there are three. One part of recovery is the physical part, where you talk about the stabilizing symptoms, which is mostly where the treatment goal is grounded, which is very important. Rehab and treatment are all related, complement each other. They have different goals, but they complement each other. Then the psychological recovery, which is really the impact of the illness in the person's hope and the person's motivation, self-esteem, and the recovery of the person's really even recovering from stigma and from discrimination that is so much happens with people who have severe psychiatric disabilities. And the third dimension is recovering of the role, recuperación de un rol, which means really working to help people find roles that they choose in environments of their choices. In other words, people want to be deciding what is it that they want to do in a specific environments or communities in their choice, but it is about their choosing what they want to do. So this is very important to understand, because when I'm presenting Abriendo Caminos guide as a tool, it's really a tool to promote recovery. We recognize and understand that this is a complement with the treatment, but we are not going to be concentrating around the symptoms of the psychiatric of the mental illness while we're doing this guide. We're really hoping to empower the person, to have a person take a look at them as persons first, not as patients. Even though sometimes they may need to go back to those roles when they see their medical providers, but this guide is being designed with all, and is embracing the values of recovery. The guide, where does it fit in all this process of psychiatric rehabilitation? As I know, as we understand psychiatric rehabilitation, the mission is to really help people develop skills and support in order to achieve roles. This process of rehabilitation readiness, which is what this guide is all about, is really trying to help the person. The Abriendo Caminos guide is really trying to help the person get ready to think about getting to rehab. So this is an evaluation which is a different evaluation from other evaluation, because we're not talking about committing to making a change or finding a job or finding a school. This is the pre-step where people are going to go through, think about it if they want to make a change to begin with. Then they want to choose a place where they want to start. Maybe they want to connect with the counselor and work a little bit more around that. Or maybe they want just to develop a specific skills so they can participate in rehab, or maybe they are ready to really choose a job, a role in a specific, whether a job in a role or a student role or a family role, or maybe they are just ready to actually go on getting those. So it is very important to, and I think when we are facilitating this process is to really help the person identify in which area of their lives. When we're thinking about rehabilitation, we talk about the living environment, the vocational working environments, the educational environments, or just the personal domains. So that's where all this guide, this tool of rehabilitation readiness, fits in the whole process of psychiatric rehabilitation. So what is it? What are the this evaluation I'm talking about? This is an assessment of an evaluation. How do we define this? How does Abriendo Caminos take into account this? Basically, the first step is the guide is a tool to help the person examine if they do want to have a goal, if they want to set a goal. If they want to examine if they want to set up a goal. We're not talking about capacity. We're not talking about excluding or including the person, because we are working with the person at all times. This type of evaluation is really designed to really help the person examine if they want to think about making a change. And this is very important because it's really more promoting helping the person see how they go about making decisions in their lives, decisions that are very important, such as work, school, maybe decisions around family issues or living situation issues. So this is really important because we're not here to determine whether a person is ready or have the skills to do so. It's just a matter of, am I ready to think about a change? So there are some indicators that we have found through many years of research at the center that are very important when we talk about rehabilitation readiness. The first one is the need for change, necesidad de un cambio. Do I need a change in my life? What is my commitment to this change? And we also talk about self-awareness and environmentally awareness. I am going to talk about each of those at a time because those were the indicators that through this project we found that were actually culturally relevant to include to include in this guide, so we can really develop a guide that's all developed in Spanish from scratch, but had also not only had that, but had the indicators to be completely relevant for the people that we work with. So the first one was necesidad de cambio, meaning needing for change. Necesidad de cambio means, do I need a change in my life? How happy am I with my current situation? And how happy are others with me in my current situation? And it is very helpful to think about this change is in 4 separate domains. Maybe I need a change in my living situation, or maybe I need a change in my vocational situation, or maybe I need a change on my educational situation, or some change in kind of relationships. And it's really important to understand that when we're happy or unhappy, this can come from 2 sources. One source could be internal sources of not feeling satisfied successfully in satisfied in what I am doing in a specific role that I have. But sometimes there are situations that others in our lives are not happy with us. Therefore, we need to make a change. Maybe it's not the change we chose to, but there's other people that said, this is something that you really need to make a change. So that's the first indicator, and we found that was very relevant for the Latino communities that we work with. The second in rehabilitation readiness indicators that we included in the guide was the nivel de compromiso para el cambio, which is commitment to change. What is it that the person think about this is going to be possible about this change, and it is positive? So in other words, am I going to be gaining something about if I think about this change? And it is even possible at all. So we really needed to really be able to find a way to try to translate these concepts, translate the concept in a way that were, first of all, simple enough for people to comprehend, and second, that were culturally meaningful for the people that we're working with. And so we came up with this way of measuring different questions about the commitment to change. So we came up with, Okay, so in order for us to measure commitment to change, what we did that so it was simple enough for the people that we were working with, we asked the following questions. So, lo podré lograr? Can I do it? So that goes with, is this change possible? Is this just thinking about the change? So when you think about doing a change, it's important that we ask ourselves, can we actually do this change? And then who is going to support me if I do this? And we found that this was very important for the Latino consumer to think about not only themselves but the family, which is very important. Familismo is one of the well-documented values. Dios, spirituality issues, also very important when people are thinking about making changes. Also, the professionals, consejeros, counselors, very important, and it actually turned out that that's one of the most important supports that the people that the pilot with was interested. And also friends that can be supports. So it's very important to understand supports not only as people, but also sometimes places or things that people need to do in order to kind of move on and accomplish those dreams and think about the things that they wanted to do. So this commitment to change, what's very unique about the guide and the Abriendo Caminos guide is it is incorporating this mix of questions with pictures, so it really makes it very simple for the individual to think about if they are really this is something that seems possible for them to do and they have supports to do it with. The third indicator of rehabilitation readiness was self-awareness, conocimiento de uno mismo, and environmentally awareness, which is mean conocimiento del ambiente. So how well do I know myself? It's actually the first question that the guide asks is, ¿qué tan bien me conozco? Do I know myself as a person? And this is very important to understand that we are really trying to, this process with this tool is to kind of help the person move from the identity that they may have of being patients into personhood. So you are helping the person think about in different ways of themselves, not only as their symptoms, but as people that have dreams and goals and that they may want to think about making possible changes in the future. So there's no expectation of the person at this point to make a decision or to go back to work right away after completing the guide. The only thing is to just be willing to go through the process and be as honest as possible with the answers that people are going to come up, because there's no right or wrong answers. It's just only about a journey into your willingness to think about making a change. So that's self-awareness. Then we have environmentally awareness, which is conozco las opciones de trabajo, estudio, vivienda. That's turned out to be very important for this Latino population because we found that there was a huge lack of environmentally awareness of resources, which is very well explained with the fact that some people have lots of language barriers, especially newly immigrants that may not exactly know how things function in this country, or they don't have English, but we found that in general people do not know where to go, so they may want to make a change. They're unhappy in their lives, but they have no idea where to go or how to go about making this change. So those were the 4 indicators that actually we found that were very helpful to include it in the guide. So I am now going to walk you through how the guide looks like, and I'm inviting you to really have the copy in front of you so you can kind of follow me and see how these indicators were developed. Okay, so now that I gave you a little bit of a background on the theories, and of course you're welcome to come and read our literature on rehabilitation readiness. We have an entire technology about that. Let me just then walk you through the guide and explain how it works. So again, just so you know, we develop all the questions and all the pictures was all based on consumer input and family members. They chose the colors, the pictures, the simplicity of the questions. They told us what is it that we needed to incorporate it in them. The guide then 4 is just an invitation to think about making a change. Okay, so the person is not has to commit to any decisions by the end. They are just walking through a process of a decision-making process, and to see, help them just to think about what is it that they want to do. So the first question, of course, is, ¿estoy listo para pensar en un cambio? Am I ready to really think about maybe the possibility of making a change in my life? How then is the guide designed to complete it? It's very simple. People really need to read every single aspect of the guide. They need to read very slowly the questions. They need to then write questions, because they're open-ended questions after each of the questions, and then they need to respond yes or no. And it's very important that people don't get confused with numbers, the numbers that are in the guide. And it's very colorful. So, but the person needs to turn each page at a time. That's the way that the guide is completed, and there's lots of instructions about that. And we'll walk through. I will walk you through in a little while. The first question then, if you think about the indicators, will be then, ¿qué tan bien me conozco? That's self-awareness. That's the first step. It's very important that when we are thinking about making a change, we get to know who we are, what's important for us. This is particularly important for Latino communities, where familismo, simpatía, respeto, respeto for generations, all this respect are values that are very important in us making decisions. There's not only sometimes about us making changes, but that involves the rest of the family, extended family. So conocer los valores, get to know our values and who we are is the starting point of this journey with the Abriendo Caminos. The second one then is, necesito un cambio en mi vida. O sea, we really want the person to examine in which aspect of their lives they are more satisfied or dissatisfied. So the person is really going to have to examine and answer the questions. Am I happy with my living situation? Sí, no. Am I happy with my educational situation? Yes, no. Am I happy with my vocational situation? Yes, no. Am I happy with my social or my personal life situation? Yes, no. So the person, what we're going to do is going to be 4 questions, one each to the picture. So the person is going to have to examine those and choose one. That doesn't mean they may be happen to be that they are unhappy on all of the areas, but for the purposes of completing the guide, we always want to work with one aspect at a time. Reason being, this is because the guide is really starting to be a starting point to starting to think about changes. It is easier to have a specific area that they work, and this is very much self-explained within the guide throughout, because the person needs to write each time in each page which area they chose to work, so they can rewrite it and they can answer the question related to the area that they chose. Sometimes it's important for the facilitator to help the person and understand there's no right or wrong questions here. This is not an exam, this is not a questionnaire, no one is evaluating because we're just thinking about a change, but it's important for them to understand that if they feel like they have changes that they want to make in all of the areas, or maybe they are in a life that they don't have any changes, but they may have a long-term goal that they may want to think about it, that's okay too. But it's important that the person chooses one direction. And it could be very confusing. So the first one, really, the goal of this is that it's easier for the person choose the cambio that is most important in their life. So, ¿qué tan importante es este cambio en mi vida? So, it's going to be some self-assessment, and the questions may seem simple to you, but the questions are actually quite complex and really get people to think about their own personal situations. So once the person have decided to choose an area that they want to work with, then the next question is, can I do it? ¿Lo podré lograr? So do I feel confident that I can do it? And the person may want to say yes, no, depending how they feel, but they want to explain why. And again, once the person is asked to move the page, the person has a space where they need to rewrite again the area of that they have chose in the previous page. The second indicator, if you recall, is the whole issue about the what am I going to gain, what am I going to lose? Commitment to change. ¿Qué voy a ganar, qué voy a perder? The picture itself really speaks to it. Every time we talk about decisions, we also need to evaluate what's going to be positive about if I make this change and what is not going to be necessarily worth about making this change. This is very important. This is something we hear a lot about among our Latino consumers, is that, for example, in the case that they wanted to make a change around work, if they may think about many positive things about going back to work, such as, being busy, making more money, being independent, gaining, but then may think that they may lose their benefits, their SSI, SSDI benefits, and sometimes that becomes the only barrier that prevents people from work. And this guide provides us a tool, an opportunity to talk about that and maybe be able to educate people about those issues with the benefits, or there may be some real gains in the current situation that the person has, that it may not be worth it at this specific time to make a change in that area. So this ganar perder is something that has been very important, and really throughout all the pilots for the last 4 years has been something very important and a very positive and well received. Then, and any change, is our life going to be better? Perhaps this maybe happen that somebody else is asking me to find a job, but I actually personally may not feel that that's something is going to be better for me. Maybe I think it's going to be worse. So it's very important to know if by thinking about making a change, my life is going to be better. Apoyo, ¿quiénes me van a apoyar? You saw this where they were coming, we're talking about the commitment, how important support is in commitment to change. Is ¿qué apoyos? Who is going to be there with me? If my family is important in decisions, is my family on board with this change that I'm thinking? If it is spiritual support that I like to get, is this support in place for me if I decide to make this change? If consejeros or professionals are the people that is my most support, are they supporting me, or am I in a situation that perhaps maybe a clinician said that I couldn't work because I have symptoms of my illness, and we know by research and by one of the misconceptions is that people can still work and recover even though they may have symptoms of the psychiatric disability. Or it could be friends, or what kind of other supports I'm going to need. So support absolutely is very important for this journey of basically contemplation of readiness to make a change, or when we talk about rehab, we talk about skills and supports. And the last one, which was relevant and was all encountered in this guide, was the environmental awareness. Conozco las opciones de trabajo, estudio y vivienda en mi comunidad. As I mentioned before, we found that there is a lot of the times people really want to do it, think their life is going to be better, they have more things they're going to gain and lose, but they have no idea where to go. And so it's very important to work with the person about really which places in the community they can go if they want to think about making a change. Inglés, social club, computadoras, okay, new places to find new housing. So it's very important to increase that. So at the end, once the person goes through this process, of course, there's always a very positive reinforcement, because just the fact that the person wanted to do this, or that you wanted to do this with your consumers, is a wonderful first step into the journey of recovery and rehabilitation. So the person, how this ends is the person is going to then, the person had answered each of the questions, always transferring the area of their lives that they want to work with. Throughout the entire book, there's a color coded system that is always going to tell you, please write in the space below the area that you chose to, because we want to complete the guide. And the guide can be recycled as many times, because every time we want to make a change in our lives or think about making a change, we want to think about this thing. So this is something that people can do several times. But for the first time, when the person, they say, chose something about their living situation, so what you do is then you go back and then you look at the tabs that are located in such a way that you can add all the yeses, the C's, and then you can add all the no's, and then you subtract yes minus no, sí menos no. And that's going to give you a score. Now, what's important here is not about the numbers itself, because it could be that the person has a minus number if the person are really ready. The numbers are just a way to kind of put a concrete answer. What's important is when the person complete this, they feel like the number they got really matches what they are doing. And there's three possibilities. The first one is if the person says, yes, I am definitely ready, meaning the person thinks it's a lot of benefit, they feel they can do it, they have support in place, then then they are so ready, but they are really actually not doing that, then what's going on that they haven't been able to actually engage in that activity? Because it seems to me like that will be somebody who is really ready to engage in setting up a rehabilitation goal and really doing rehabilitation work at the moment. If the person says, I'm not sure, it will be reflected in the guide. It's probably because there's a conflict someplace. A conflict maybe in the things you're going to gain, you're going to lose. It could be a function of not having enough supports, or it could be a conflict, an issue maybe not having the confidence to do it. So if I'm not sure about it and I got into that score that you could see when you're doing the guide, it just means the person is not quite ready yet. And this is important. Then that we, instead of saying, okay, now you cannot come back to my program until you do these things, is that we help the person then get ready. If it's lack of support, let's find people that can support you. Tell me who is important for this, and then I help you. Because I'm not measuring, remember, I am not measuring capacity. I am not excluding or including people by doing this guide. I'm just assessing if they are ready to think about a change. So if what happens is, let's say somebody doesn't have any self-awareness, so maybe I may want to do some work around, maybe they've been very much into the mental health system for many years and it's hard for them to think about themselves as people first, so I may want to work on that. Or if it's environmentally awareness, I may just need to send to let's go and meet the community. And at the end, there's lots of recommendations that people can do if you find yourself in a situation that maybe somebody is not sure. If the person says, definitely I am not ready, there's nothing wrong with that. And in fact, it's very important from the beginning to understand there's no right or wrong in this. Again, this is not a right or wrong type of a test. If the person is not ready, it means that then we need to help the person, help them get ready to be thinking about making a change. And thinking about this way, this is then what we'll call developing readiness, which is really developing different strategies to facilitate that process so the person gets ready. So by doing this kind of exercise, and again, if the person said no, then at the end there's lots of recommendations that one can have. Entonces, like I was saying, then the person is going to come up with a sí, no, no sé, or no, meaning yes, I'm not sure, no. If the answer then is I'm not sure or no, then it's what we call developing readiness for rehabilitation, o sea, el desarrollo de la preparación, which means it is creating opportunities for this person to really learn and develop different skills so they can participate or different skills or develop support so they can participate actually in the process of rehabilitation. So it is very important to understand, because sometimes it's very hard for people to come up with a no answer. They think there's something wrong with it. And because the attitude of the facilitator is so important in this process, it's very important that we're clear about that process. Okay, so now that I explained to you how we went, the principles and values behind the guide, how we developed the guide. You saw the pictures, the questions. Those were indicators that we found were relevant for the Latino community. Therefore, they're culturally relevant and at all times really respects the person's choices. So, what will it take for you? You know how to get functions. I am going to talk to you a little bit about who can be a facilitator for this guide, because I think it's very important to understand that, first of all, this is a tool that you use to facilitate a relationship. It could be, I can tell you how it's been used so far. Some people have been using it as a part of the intake. They complement their intake. It only takes 30 to 40 30 to 45 minutes to an hour to really complete the guide. So it's something that is short and is easy to do because the language, the Spanish level is simple, the questions are simple. So some people complement their intake. Some people do it when somebody's really stuck for there in a situation for a while, and then people want to kind of, facilitate. Some people have been using individually, and some people actually have been using in groups. All kinds of groups, not necessarily, this is not only for people who want to go into vocational rehabilitation or educational. It can be used even in groups of people that are working with, substance abuse or contemplating all other kinds of changes in their lives. So we had found that, and you can see actually the comments, in our CD of the people that have been actually utilizing the guide. I think what's more important about is that whoever the facility, if you choose to become a facilitator for Abriendo Caminos, is first of all you really need to read the instructions of the guide that comes with this guide. But it's your attitude. This is a tool that is really there to empower the person to really respect who they are, not only as a person culturally, but also who are their dreams. This is a great opportunity to really open doors for the person to think about if they want to make a change. It's not about absolute, it's not about right or wrong. It's not about you as a clinician, if you are a clinician, deciding what to do, or if you're a family member deciding what's best for the person. It's about the person deciding what is it that they want to do. So when they decide, or if they are not ready and you need to develop some readiness, then you can send them and refer them and give them the appropriate set of support and skills that they need to complete this. So what I want to do is, I want to, now that I talk to you and you may talk, I want to point a few things about the guide that I think are important. First of all, you can see the guide is very colorful, has the sun, is really inviting the person to really, let's dream and let's open paths in their life. So abriendo caminos, la puerta se abre, and I want to explore what is that I wanted to think about it. You clearly have all the collaborators and all the agradecimientos and all the people, because we couldn't have done it without you being present, all the people that we work with through the entire time. The benefit is very clear. I mean, if I know what I want to think about it, then I'm going to make sure once I get to the person that's going to be helping me achieve my goal, I'm going to be at the right person. So if I really want, if it comes that I really want to make a change in my job, so then maybe vocational rehabilitation is appropriate for you. But if you got referred because that's where everyone gets referred, but really your dream is to find a new housing situation, then you go refer to vocational rehab, but you really want to be able to be someplace else. So the benefits, there's very clear instructions on how to complete the guide, but please make sure that you help the person read every single aspect, because you want to start to read this, because this is the pre-idea for the next page, and it really gets people to think about it. There's no need to rush. If you have to rush, it can be done quickly, but even though the questions look simple, this is something that can take for a long time, and you can even do one question at a time in order to connect with the person you are working. So the self-awareness, so when you see here, this is what I point out to you, do not get confused with the numbers, and to make sure that people don't answer this right away, because it could be that people think that they have to answer the question as it is here. So the person really needs to answer one question at a time, one page at a time. So I ask myself, que también me conozco, mis valores, my values are, I write them down, mis intereses son, I write it down, and basically the sí or no, yes or no, is to answer, que también me conozco. So conozco lo que es importante para mí, so the person needs to say yes or no. Don't let the people get distracted by the number 11. These numbers, 11, 20s, these all got out of all the analysis, in vivo analysis that we did with the questions when we did all the focus groups in order to include the indicators that were culturally relevant. In page number 7, this is when the most important piece of the guide is because, as I said before, you want to be able to work with one aspect at a time. So it may happen that the person is very unhappy in all of the aspects, or but they want to make a choice of only one aspect. Or it may happen the person is very happy with all their lives and they don't want to make any changes in their lives. There's always sometimes room for maybe a long-term desire of change. Usually the people have one thing in their life they want to maybe improve. So the person is always in this color that is brownish color. The person is going to be asking every single page. They're going to be asked to complete that area so they can complete it. Okay? So then we ask the person here. Here then we have to say, ¿qué tan importante es este cambio en mi vida? How important is this change? And the person wants to write the aspect that they chose and then answer yes or no. And the same for the rest of the questions. ¿Podré lograrlo? El cambio que voy a hacer, why? And do I do yes or no? Again, not worries about the numbers at any point because that's something that may distract the person, but you want to keep always reading and making sure that the person reads this part of in here. ¿Qué voy a ganar? ¿Qué voy a perder? What I'm going to get or lose in this. We already talked about these concepts are very important indicators for this process. Then the person is going to mark yes or no. Then we go to mejorará mi vida. Is my life going to be better? And again, here is, ¿quiénes me van a apoyar? Who is going to be my support systems? And why? Is it important? And if I do have enough support, or I may feel that I may not have support. I may have support to make a change. Let's say if I chose working with the house, for example, let's say I live with my family. And I do want to live on my own because I'm an adult and I am tired to live with my parents. And that's the change I want to do. But it may be that my family or my parents don't feel the same way. They may want to actually, want me to stay with them. So sometimes you may not have support for, the person may have no support for the change that they specifically chose to work through the workbook. And here is the environmentally awareness. Es conozco las opciones de trabajo, estudio, vivienda en mi comunidad. So that's pretty much well established. And the person, again, for every question there is a space to write and then the person will add. So, once we, of course, the person, we're proud the person completed, it's very important on page 21st that you pay a lot of attention in how to do the adding and subtracting because that could be a little bit confusing, okay? So you really need to add. Basically, what it's asking you is you want to add all the yeses, see under this column the numbers and put the total here on the yellow. You see C is yellow, C yellow, and then here the no's are the blue. So you want to add all the blues and see. Then you want to do subtract yes, C versus no, and that's going to give you a score. Again, the important piece here is that the person went through this process. And the score, if it's done correctly, and it's been the experience of the people using the guide, is that the score actually reflects the reality of where the person stands. And that's something you can see that we did on the city. So the person will write their score here, and then they're going to see where they fall. So there is a score between 170 yes, I'm not sure, is 69 to 40, and then no. Again, I repeat, this is very, very important. There's nothing wrong with saying no. The point here is that if somebody really is eager, they're still like not sure. Let's say somebody's really eager to make a change. How come they still haven't done anything? So what is it that is needing for order for them to really move? And this will be a very good way to assess actually what to do, because then that's the next question. So now that I do this, what do I do? What was the point of making all this guide, this invitation to think about a change? Well, the point here is that you will read. If you are ready, estoy listo, then means the person is basically, you want to start thinking, having a rehabilitation goal set and have a date and starting point already planned out, and engage in rehabilitation goal setting. If you are not sure, then you want to basically probably ask for more information and see which pieces they want to do. Maybe it's doing more information, maybe it's learning English, maybe it's whatever is it that they're not sure about it. Here in the last pages 24, 25, you find lots of recommendations that help you develop in readiness for rehabilitation, meaning le ayudan a prepararse más a la rehabilitación. And this may change from area to area, but I think it's important. There's recommendations under each of these areas. So if I don't have self-awareness, there's some recommendations in how to improve getting to know yourself better, so you can then decide what is it that you want to think about it. If you I'm not sure you want to really change all of the aspects of your life, and for some people it may be very hard to make choice of one, you may want to spend a little bit more time clarifying that. But you can read through those because I think you have the book and you have everything in front of you as you do this. So there's also some suggestions for reading, and of course in our website you have this technology. The rehabilitation ready technology is being developed after many years of research. It's all in English, but this is only in Spanish, with the hope that we really outreach the largest minority group within the U.S. at this point, and which Spanish language barriers are a huge issue in order to access vocational rehabilitation. If you want further information, make sure you visit our website www.bu.edu/CPRP, and then you can look into the Latino initiatives. There will be information in Spanish as well as in English, and there's all other publications and books that will help you learn about how the process and support your learning in the field of psychiatric rehabilitation. Thank you very much.